Hello everyone. In this lecture, we are going to study about the lymph nodes. Okay, we'll discuss about the basics. That means we'll discuss about the structure of the lymph nodes in detail. So lymph nodes, they come under the secondary lymphoid organs. So as you all know, primary lymphoid organs, these include the bone marrow and the thymus. Bone marrow and the thymus are the primary lymphoid organs. They help in production of the immune cells and also their maturation. Among these, we have already discussed about the bone marrow, and about the thymus we'll discuss in a separate lecture. Then we have various secondary lymphoid organs like the lymph nodes, spleen, mucosal associated lymphoid tissue, etc. So there are various secondary lymphoid organs, and lymph nodes are important secondary lymphoid organs. Lymph nodes are basically small vein or kidney shaped structures. Lymph nodes are covered by a capsule. These are encapsulated organs. So it will have a connective tissue capsule. This capsule will throw multiple projections into the lymph node architecture. These projections are known as trabeculae. These projections are known as trabeculae. And these trabeculae will divide the lymph node into multiple compartments. Okay. These lymph nodes will have a convex surface. So this is the convex surface. And in the convex surface, you will find multiple afferent lymphatics. So these are afferent lymphatics. These are the afferent lymphatics. Okay. So lymph will flow through these afferent lymphatics into the lymph nodes. Okay. And after circulating inside the lymph node, the lymph will come out of the lymph node through the efferent lymphatics. So these are the efferent lymphatics. These are the efferent lymphatics. So we discussed about the convex surface, which contains the afferent lymphatics. Then we also have a concave surface. So this is the concave surface, which is known as the hilum. So hilum is the concave surface of the lymph node. This hilum, along with efferent lymphatics, this will also contain the artery, which is going into the lymph node, and it will also contain the veins, which is coming out of the lymph nodes. Okay, so this is clear. So lymph node is covered by a capsule, which throw multiple projections into the lymph node architecture. Those are known as the trabeculae. Lymph nodes have convex surface, which contains the afferent lymphatics, and it has a concave surface, which is known as the hilum, and the hilum will contain the efferent lymphatics, arteries, and the veins. Okay. If you see the flow of lymph inside the lymph node, so basically lymph will come into the lymph nodes through this afferent lymphatics. After that, they'll flow in the subcapsular sinuses. These are known as the subcapsular sinus. Okay, so these are known as the subcapsular sinuses. We'll discuss them in the next slide also. Then they'll flow in the trabecular sinus. So this is the trabecular sinus. Then they'll go into the medullary sinus. So this is the medullary sinus. And ultimately, they will come out of the lymph node through the efferent lymphatics. So this is the flow of lymph inside the lymph node. Okay, so afferent lymphatics, then the subcapsular sinus, because that is present just below the capsule. Then the trabecular sinus, because they are present near the trabeculae. Then the medullary sinus, because these sinuses are present in the medulla, and it will come out from the lymph node through the efferent lymphatics. Okay. Then if you see the arteries and veins, arteries, after going into the lymph node, they will be divided into arterioles. Then they will make the capillaries. Then there will be venules, and ultimately the blood will come through the veins out of the lymph nodes. Okay, so blood flow into the lymph nodes happens through the arteries. Ultimately, it will come out through the veins. Okay, and if you see the inner structure of the lymph node, it is divided into three parts: the cortex, paracortex, and the medulla. The outer part is the cortex, the inner part is the medulla, and the intermediate part, the part which is between the cortex and the medulla, is known as the paracortex. Okay, so if you see here, the area which is present above this line, so that means this part is the cortex. Then this part is the medulla. This is the medulla. This is the cortex. This is the medulla. and the in-between structure, that means this area, this part is the paracortex. Okay, we'll discuss each of these parts in subsequent slides. Okay, now you can also appreciate that in the cortex we are finding follicles. Okay, you are finding follicles. So these are the follicles which is predominantly containing the B lymphocytes. Okay, these follicles will contain B lymphocytes. Along with B lymphocytes, you will also find follicular dendritic cells, reticular cells, and macrophages in the cortex. Okay, follicular dendritic cells, reticular cells, and macrophages in the cortex. And in the paracortex, we are going to find the T cells. So paracortex is rich in T cells. T cells will not have a nodular arrangement. Okay, so B cells, B lymphocytes will have a nodular arrangement, but T cells will have a non-nodular pattern of arrangement. Okay, so T cells are present in the paracortex. In the medulla, we have medullary sinuses, as I have already told you. Apart from medullary sinuses, the rest of the structures are known as medullary cords. So we'll have the medullary sinuses and also we'll have the medullary cords. Okay, so medullary sinuses, they will contain the macrophages and the reticular cells, and the cords will contain the plasma cells and the lymphocytes. Okay, anyways, we'll discuss all those things in detail in subsequent slides. Now let us first start our discussion with the cortex of the lymph node. Okay, so if you see the cortex, so what are the structures are there in the cortex? So if you start from the lymphatic flow again, so this is the afferent lymphatics. This I have already told you. Then we have subcapsular sinus. Okay, so lymph, after going through the afferent lymphatics, it will enter the subcapsular sinus. It will enter the subcapsular sinus. So this area is the subcapsular sinus. Then it will flow into the trabecular sinus. Trabecular sinus. This is otherwise known as the cortical sinus. Okay, trabecular sinus or cortical sinus. And after that, it will go into the medullary sinus and will go out of the lymph nodes to the efferent lymphatics. But in the cortex, what we can find in the cortex, we can find the subcapsular sinus and the trabecular sinus. Then we'll see the follicles. So basically, follicles, if you see, this is as I told you, these are composed of B lymphocytes. Okay, so follicles again, they are divided into primary follicles and secondary follicles. So if you see this follicle, this is actually a primary follicle. Primary follicle. Follicles are made up of B lymphocytes. They are made up of B lymphocytes. This is a primary follicle. Why it is primary follicle? Because it is inactive. It is inactive, or you can say quiescent. So inactive follicles are known as the primary follicles, and they are darker. So if you see, it is a darker compared to the secondary follicle. So this is the secondary follicle. Secondary follicle. The secondary follicle is actually active follicle. So basically, inactive follicles, I mean, they are not in contact with any antigens. They are not exposed to any antigens. Okay, so these are quiescent or inactive follicles. These are darker. But if you see the secondary follicles are formed after exposure to the antigens. Okay, once the B cells are exposed to antigens, they will start to proliferate. Once they start to proliferate, the proliferating or the active B cells will come to the center of the follicle. So if you see the structure here, on the outer part, you can see the darker B lymphocytes, but the inner part, you can appreciate, in the inner part, you can see these are the activated B lymphocytes. These are the activated B lymphocytes. Whenever a cell is active, the nucleus will contain open chromatin. Okay, whenever the cell is active, the nucleus will contain open chromatin, because open chromatin can be transcribed and ultimately translated. So these activated B lymphocytes, they will contain the open chromatin. That is why they will give a lighter appearance to in the central area. That central part is known as the germinal center. The central part is known as the germinal center. Germinal center. Okay, and the darker area surrounding the germinal center, that will still contain the inactive B lymphocytes, and that darker area which is surrounding the germinal center, that is known as the mantle zone. Mantle zone, or sometimes known as corona also. Corona. Okay, so primary follicles, these are darker. They will contain the inactive B lymphocytes, otherwise known as the quiescent follicle. Secondary follicles, after exposure to antigen, these are known as the active follicles. This will contain the central germinal center, which will have the activated B lymphocytes with a open chromatin. And these are also slightly larger than the normal B lymphocytes. They will have open chromatin. And that is why they will give a lighter appearance. Surrounding this germinal center, we will have still some inactive B lymphocytes, which are darker in appearance. That is known as the mantle zone, otherwise known as the corona. Okay. Apart from these follicles, we will also have the follicular dendritic cells. So these are actually follicular dendritic cells, FDCs. Follicular dendritic cells. We also have the reticular cells. And this will also contain macrophages. This will also contain the macrophages. Okay. So in the cortex, you will find the subcapsular sinus, trabecular sinus. You will find the follicles, primary and secondary follicles. And you will also find some other cells like follicular dendritic cells, reticular cells, and macrophages. Okay. So what this reticular cell is going to do? Now we have to understand the function of each of these cells. Okay. We'll discuss them one by one. In this slide, I'll just tell what is the function of reticular cells. So reticular cells, they are going to produce type 3 collagen. So reticular cells, they will produce type 3 collagen. Okay, they will produce the type 3 collagen. So type 3 collagen are the predominant form of collagen that we can find in the lymph nodes. It's a very important question. Okay. Now we'll understand what are the functions of follicular dendritic cells, what are the functions of macrophages. Okay, in the next slide. But before that, a very important question. I mean, this is asked in many exams. The follicles are underdeveloped in. Okay, so in which condition the follicle is going to be underdeveloped? So any condition that will lead to decrease in B lymphocyte production, any condition, especially the congenital immunodeficient syndromes, where the B lymphocyte production is reduced. In those cases, you will not find follicles. You will not find follicles in the lymph nodes. So follicles are underdeveloped in. Classically, if you want to remember one example, the classical example is Bruton's A gamma globulinemia. Bruton's A gamma globulinemia. So this is a condition. We will discuss in detail under the immunology section. This is a condition where there is a defect in the B cell production. So that is why follicles are underdeveloped in this condition. Of course, there are various other conditions. This is the classical example. Okay. So if you want to revise, I just revise it again. So in the cortex, we are going to find the subcapsular sinuses. We are going to find the trabecular sinuses or the cortical sinuses. Then you will have the primary follicles, which will contain the inactive B lymphocytes. You will also have, if they are exposed to antigen, you will also find the secondary follicles, which are active follicles. Apart from these, you will find various supporting cells. You will find various other cells like you will find the follicular dendritic cells, reticular cells, and the macrophages. Okay. Function of reticular cell is to produce the type 3 collagen. Okay. Now we'll see what is the function of follicular dendritic cells and what is the function of macrophages. Okay. So this we have already discussed. We have a primary follicle, sometimes it is known as primary nodule also. So you can see it is filled with B lymphocytes. These are filled with B lymphocytes, which are inactive. You can see the nucleus is containing condensed chromatin. Nucleus have the condensed chromatin. That means these chromatins are not active. Okay. Why these are not active? Because they are not exposed to antigens. And surrounding this follicle, you will find the macrophages. So this is the macrophage. And you will also find the follicular dendritic cells. You can also find the reticular cells. Okay. What happens when there is exposure to antigen? If it is exposed to antigens, there will be activation of the B lymphocytes. So in the germinal center, we will find the activated B lymphocytes. These activated B lymphocytes are again divided into centroblast. Okay. So you can see here. So this is actually a centroblast. Centroblast. The centroblast will further mature into centrocytes. Here, centroblasts are the largest. I mean, among the B lymph, during the process of activation of the B lymphocytes, centroblasts will have the largest volume. They will have open chromatin. Okay, they will have open chromatin and prominent nucleoli. Okay, so centroblast will have open chromatin with prominent nucleoli. Then they will become centrocytes. Centrocytes are slightly smaller than the centroblast, and they will have kind of twisted. Sorry, this is also a centroblast. This is also a centroblast because it is having the open chromatin. This is a centrocyte. This is a centrocyte. Okay, centrocytes are slightly smaller compared to the centroblast. They will have a twisted nucleus. Okay, twisted and slightly darker nucleus, and they will also have surface immunoglobulins. Okay, so centroblasts are larger cells. They will have completely open chromatin. They will not have surface immunoglobulins. So if I just write here, centroblast, they will have open chromatin with the prominent nucleoli, and surface immunoglobulins are not present. But centrocytes, they will have kind of twisted nucleus, twisted or cleaved nucleus. Sometimes it is written as cleaved nucleus, and they will have surface immunoglobulins. They will have surface immunoglobulins. Okay, so centrocytes and centroblasts. Now these centrocytes, now they will be exposed to the follicular dendritic cells. Okay, so whenever there is secondary follicle formation or secondary nodule formation inside the germinal center, along with activated B lymphocytes, you will also find the macrophages, follicular dendritic cells, and reticular cells. Okay, in the primary follicles, these macrophages, follicular dendritic cells, and reticular cells, these are usually not present inside the follicle; they are only present outside the follicles. But whenever they make the secondary follicle, these cells can come into the germinal center. Why they are important in the germinal center? Because now once the centrocyte is formed, it has to be exposed to the follicular dendritic cell. How this interaction happens, I'll show in the next slide. So once it is exposed to the follicular dendritic cells, the follicular dendritic cells can identify those centrocytes or those activated B lymphocytes which are presenting surface immunoglobulins, or you can say they are presenting receptors for the self antigens. Okay. So if the centrocytes are presenting receptors for self antigens, those centrocytes has to undergo apoptosis. If they are not undergoing apoptosis, they can develop autoimmune reactions. Okay. So our immune system doesn't want autoimmune reaction. Our immune system wants only to produce those lymphocytes which can recognize the foreign antigens, not the self antigens. Okay. So if these lymphocytes, if these centrocytes, they are producing receptor for self antigens, they have to be destroyed through the process of apoptosis. And this is done by follicular dendritic cells, because these follicular dendritic cells can actually recognize those activated B lymphocytes which are producing receptor for self antigens, and they will give signal for their apoptosis. Okay, so this interaction is important. That is why follicular dendritic cells should present in the germinal center. Okay. So with further development of centrocytes, if the centrocytes are not presenting self antigens, they are not presenting receptors for self antigens. They are presenting receptors only for the foreign antigens. They can be either converted to the memory B cells. They can be converted to memory B cells for future use, and also they can be converted to plasma cells. Now these plasma cells now can go into the, they can go into the medullary cords, and there they can produce the antibodies. They can produce the antibodies, and these antibodies will go to the circulation. Okay. So you can see here. So inside this germinal center, there will be production of the plasma cells. Okay, that is the ultimate function of the activated B lymphocytes, to produce the plasma cells, because plasma cells can produce the antibodies against the antigens. Okay, so once the plasma cells are formed inside this germinal center, these plasma cells will come out of it, and it will go to the medullary cords. And in the medullary cords, they will produce the antibodies. They'll produce the antibodies, and those antibodies can go into the circulation. Those antibodies can go into the circulation to fight against that antigen. Okay, so this is what normally happens. And also some of the activated lymphocytes can come into this medullary cord. Okay, so along with plasma cells, some of the activated B lymphocytes can also come into the medullary cord. So it's in the medullary cord, you are going to find lymphocytes and plasma cells. Okay, so if they ask you what is the predominant cells in the medullary cords, it is plasma cells and the lymphocytes. Okay, so this is what happens in the secondary nodule. Now we'll see the interaction between the follicular dendritic cell and the lymphocytes and the activated B lymphocytes. Okay, so if you see this is a follicular dendritic cell, you can see these are the dendritic processes. The first thing is you should not be confused this with the dendritic cell. You should not be confused with the dendritic cell. Okay, so dendritic cell, it will have a structure very much. This will have a structure very much similar to the follicular dendritic cells. However, dendritic cells are actually antigen presenting cells. These are antigen presenting cells. Okay, so dendritic cells are usually present in the skin and various other parts also. We'll discuss more on this under immunology section. These dendritic cells can recognize the foreign antigens. They can process the antigen, and ultimately they can present those antigens on their surface to especially to the T lymphocytes, and also to lesser extent to the B lymphocytes. Okay, so that is why these are known as the antigen presenting cells. They can take up the antigen, process, and present on the surface to the T lymphocytes for further processing. Okay, so that is the function of dendritic cell. And dendritic cells are originating from the bone marrow itself. Okay, so dendritic cells originate from the bone marrow, and these are antigen presenting cells, and they will have MHC class 2 expression, MHC class 2 expression on their surface. Okay, we'll discuss more in detail about this in the immunology section. Okay, so these are the properties of dendritic cells. Okay, these are the classical antigen presenting cells. However, follicular dendritic cells, they have structural similarity to the dendritic cell, but functionally they are different. Okay, and of course these are not originating from the bone marrow. Follicular dendritic cells originate from they have mesenchymal origin. They have mesenchymal origin. These are not antigen presenting cells. These are not antigen presenting cells. I mean, they will not process the antigen and present on the surface. And also they do not express the MHC class 2 molecule. All the antigen presenting cells should express MHC class 2 molecule on their surface. But these follicular dendritic cells, they are not going to express these MHC class 2 molecules. So these are the difference between a follicular dendritic cell and a classical dendritic cell. Then what is the function of follicular dendritic cell? Now, follicular dendritic cells will have certain receptors. Okay, so if you see here, this is one receptor. This receptor is actually FC receptor. FC receptor. This is a FC receptor. That means it can identify the FC portion of the antibody. So if you all know antibody, if you see, this is the antibody. This is the FAB portion. FAB portion, and this is the FC portion. Okay, FAB portion and FC portion. The FAB portion can bind to the antigens. It can recognize the antigen. It can bind to the antigen. And this FC portion can bind to FC receptors. Okay, so follicular dendritic cells have FC receptors which can recognize the antibodies which are already bound to some antigens. Okay, so especially the IgG class of antibody, they act as opsonins. So what are opsonins? Opsonins are those substances which can bind upon certain antigens, and make these antigens palatable for the macrophages, or you can say for the follicular dendritic cells. So basically, they are making these antigens palatable for various cells. So these are known as opsonins. And among the immunoglobulins, IgG is a very important opsonin. And among the complements we have discussed when we discussed about the complement system, C3b is the classical opsonin among the complements. So C3b can also act as opsonin. And follicular dendritic cells present, they have receptors for both this IgG FC portion, and also they have receptor for this complement. So they have complement receptors. These are known as CR1 or CR2, complement receptor 1 and complement receptor 2. Okay, so that means they can identify these opsonins, and indirectly they can have these antigens. They can identify these antigens with the help of these opsonins. Okay, so this is the complement. You can see this is the C3b, which is also binding to the antigens. Okay, so follicular dendritic cells, they will express this FC receptor for the immunoglobulins and the complement receptors. Okay, they will not process the antigen and present to the surface, unlike the classical dendritic cell. Classical dendritic cell can process the antigen and can present the antigen on the surface to various lymphocytes. But follicular dendritic cells will not process the antigens. They can only hold those antigens which are bound to the opsonins like immunoglobulin G and C3b. Okay. Along with that, these follicular dendritic cells, they can produce some chemokines, like they can produce certain chemokines like CXCL13. So what is the function of this chemokine? This chemokine will actually attract the B lymphocytes to the cortex. Okay. So you must be thinking how beautifully these lymphocytes are organized inside the lymph nodes. That B lymphocytes are organized only in the cortex, T lymphocytes are organized only in the paracortex. So how is this possible? This is possible because of various chemokines. Okay, so certain chemokines are there in the cortex which can attract the B lymphocytes. So that is why B lymphocytes will populate the cortex. There are certain chemokines which are present in the paracortical area which can only attract the T lymphocyte. That is why T lymphocytes are populated in the paracortical region. Okay, so this chemokine CXCL13, which is produced by the follicular dendritic cells, this will attract the B lymphocytes. So that is why B lymphocyte will come and they will stay in the cortical areas, in the cortex. Okay, so these will attract these are chemokines for the B lymphocytes. Okay, so now once this follicular dendritic cells, they have once they have recognized the opsonin bound antigens, now these antigens can be presented to, these antigens can also be recognized by this B lymphocytes, especially the activated B lymphocytes, as I have already told you. Sorry, the normal B lymphocytes. Then these B lymphocytes will be activated. So this process is happening. Here. That is at the outer area of the outer area of the follicles. Okay, those follicular dendritic cells which are present at the outer part of the follicles, they can express, they can hold these antigens so that the B lymphocytes can recognize these antigens. Okay, so these follicular dendritic cells, once they hold the antigens which is recognized by the B lymphocytes, now the B lymphocytes will be activated. Okay, now these will be activated, and these activated B lymphocytes will come into the center to form the germinal center. Okay, and I have already told you, once they're activated, first they will form the centroblast, then they'll make the centrocyte, which will contain a cleaved nucleus with the surface immunoglobulins. And I have told you, if they present surface immunoglobulins which can identify the self antigens, these will undergo apoptosis. And for this process also, the germinal center follicular dendritic cells help. Okay, so germinal center follicular dendritic cells, they will try to recognize those activated B lymphocytes which are expressing receptor for self antigens, and they will help in the process of apoptosis. They will give signal for apoptosis. Okay, so follicular dendritic cells have two important functions here. One is those follicular dendritic cells which are present just outside the follicles, they will hold the antigen so that the normal B lymphocyte, the naive B lymphocytes, can recognize those antigens and they are activated. Once they are activated, once they form the centrocytes, again these centrocytes will interact with the follicular dendritic cells which are present inside the germinal center. And if they are presenting receptor for self antigen, they will undergo apoptosis. Okay, and once they undergo apoptosis, the macrophages will come and they can digest these apoptotic materials. Okay, so this is the function of macrophage in the cortical area. Also, macrophages, they act as antigen presenting cells. Okay, so these are the important function of macrophages in the cortex. They act as antigen presenting cells and also they help in apoptosis. And those centrocytes which are not presenting receptor for self antigens, they will further differentiate into either a memory B cell. They'll either become a memory B cell. Memory B cells will stay in the germinal center itself. Okay, they will stay in the germinal center itself for future purpose. Okay, for future purpose, and also they will form the plasma cells. They will form the plasma cells. Plasma cells can be identified by their eccentric nucleus. You can see they have a eccentric nucleus, and also the nucleus will have cartwheel shaped chromatin. Okay, we'll discuss again in detail about the plasma cells separately. Now, these plasma cells, as I have already told you, they will go to the medullary cords along with the activated B lymphocytes. Okay, so activated B lymphocytes along with the plasma cells will go to the medullary cords. From the medullary cords, they'll especially produce the immunoglobulins, which will go out into the circulation. It will go into the circulation. Similarly, from the medullary cords, the activated B lymphocytes will also go into the circulation. Okay, so this is what happens normally. So this is the function of follicular dendritic cells. And we have also discussed about the function of macrophages. We have also discussed about the function of reticular cells, and we have discussed in detail about the follicles. Okay, so this is all about the cortex. Now we'll see the paracortex. Other things are relatively simple. Paracortex, as you can see here, paracortex usually contain the T lymphocytes. They contain the T lymphocytes. They will have a non-nodular arrangement. They will have non-nodular arrangement. And you can see these areas are thymus dependent. Thymus dependent. Why these are thymus dependent? Because T cells mature in the thymus. Okay, B cells, they are produced, B lymphocytes are produced inside the bone marrow. They are matured inside the bone marrow itself. But the T cells, after being produced inside the bone marrow, they will go into the thymus for their maturation, and after that it will come into the circulation. So this area, the paracortical area, which is containing the T lymphocytes in a non-nodular pattern, these are thymus dependent. So if the person doesn't have thymus, this paracortex will not be developed. So that is why it is underdeveloped in all those conditions where the thymus is not developed. So the classical example is Dye-George syndrome. The classical example is Dye-George syndrome. Where there is third and fourth pharyngeal pouch defect, there will be underdevelopment of the thymus. In those conditions, we are going to have underdeveloped paracortical area. Okay, we'll discuss about Dye-George syndrome under the immunology section in detail. So apart from these T lymphocytes, sometimes you will also find classical dendritic cells here. Okay, actually classical dendritic cells, these are not present inside the lymph nodes. Usually these are not present inside the lymph nodes, but whenever these classical dendritic cells find some antigen, they will process the antigen and they will come into the lymph nodes. In the lymph node paracortical area, they will present these processed antigens to the T lymphocytes. Okay, so sometimes in the paracortical area, you can also find the dendritic cells. Okay, so if you see dendritic cells, these are classical antigen presenting cells. They will have MHC class 2 molecule. This is the MHC class 2 molecule. You can see here. Once they recognize the antigen, they can process the antigen and they can present on the surface. This antigen can be recognized by the CD4 plus T cells, T helper cells, and MHC class 2 molecule helps in this process. Okay, so this is what happens normally. So sometimes classical dendritic cells you are going to find in the paracortical areas. You will not find the follicular dendritic cells. Follicular dendritic cells are present only in the cortex. Okay. And of course, macrophages and reticular cells, they are present everywhere. So in paracortex also, you can get the macrophages and the reticular cells. We'll discuss about this processing and how dendritic cells present to the T cells in detail in immunology section. Then what else we are going to find in the paracortical area? We will find the high endothelial venules. High endothelial venules. What are high endothelial venules? So these are nothing but the specialized endothelial cells in the venules. So as you can see here, this is the artery, then the arteriole, this is the capillary. Then we have the post capillary venules. So these are the post capillary venules. Normally the endothelial cells are present like this. Usually they are flat. But in this area, in the paracortical areas where you have the post capillary venules inside the lymph node, we are going to find some specialized endothelial cells. These are known as high endothelial cells. So as you can see here, these are somewhat elongated, these are somewhat larger. These are known as high endothelial venules. They have special receptors. They have a special properties that these high endothelial cells, they will have special receptors, and these special receptors can identify, they can identify the various lymphocytes. They can identify various lymphocytes, B and T lymphocytes, which are flowing through these arteries and coming to the venules. These lymphocytes can be taken up by these endothelial cells and thrown into the lymph nodes. Okay, so this high endothelial venules helps in taking up the lymphocytes from the circulation into the lymph nodes. Okay, so they help in taking up of lymphocytes from circulation into the lymph nodes. And now these lymphocytes, depending on the chemokines, okay, so T lymphocytes, they will be attracted by the chemokines which are present in the paracortical area. So the T lymphocytes will go to the paracortex. Okay, and the B lymphocytes will be attracted by the chemokines present in the cortical area, like CXL13. So B lymphocytes will go and populate the cortex. Okay, but all these T and B lymphocytes, they are coming into the lymph node through these high endothelial venules, which are present predominantly in the paracortical area. Okay, so this is about the paracortex. Now coming to the medulla. Medulla, we have already discussed, it is composed of sinusoids and the cords. Okay, so you can see these are the sinusoids, and the intervening areas, these are the cords. In the sinusoids, we are going to find the macrophages. Medullary sinusoids or medullary sinuses, they will contain the macrophages and also the reticular cells. Macrophages and reticular cells are usually present in all the parts. And in the medullary cords, I have told you multiple times, this will contain the plasma cells and the activated lymphocytes. Plasma cells and activated lymphocytes. So once the B and T lymphocytes are activated in the respected areas, they can come into the medullary cords, and from there it can go into the systemic circulation. Also the plasma cells, after getting produced in the germinal center, they will come to the medullary cords, and here they can produce the immunoglobulins, which will go into the circulation. Okay. Now, one more point I want to tell is these macrophages, actually these macrophages are also present in all these sinuses. Okay, so macrophages are present in also in the subcapsular sinus, it is also present in the trabecular sinus. Okay, and sometimes these are known as histiocytes. Okay, actually histiocytes, it's a broad term which includes both macrophages, which include macrophage and the dendritic cells and various similar type of cells, histiocytes. But most of the times when we tell histiocytes, we refer to the macrophages. Okay, this is just another name for macrophages. But broadly, histiocytes are named for this macrophages, dendritic cells, and similar antigen presenting cells. Okay. So we have discussed about the cortex, we have discussed about the paracortex, we have discussed about the medulla. So let's just see the normal histology image. So as you can see here, this is a lymph node. You can see this has a capsule and it has multiple trabeculae. This is also a trabeculae. Okay, you can appreciate the cortex. So you can, in the cortex, you can see these are the follicles. Especially, you can see these are actually the secondary follicles. You can see in the center, it is pale, which is containing germinal center, and outside the center, germinal center, you can appreciate there is a mantle zone. Okay, so these are the follicles which are present in the cortex. This area, you can see these are the paracortical areas where you can find the T lymphocytes. And inside, you can find this. This is the medulla. This is the medulla. Okay, and this area is the hilum. This is the concave area, which is hilum, which is also containing the efferent lymphatics, arteries, and the vein. Okay. So this is about the normal lymph node structure. I have not told about the lymphatics and the lymphatic circulation, that we'll be discussing separately. But this is about the basics of normal lymph node structure, architecture, and we have also discussed in detail about the what are the exact functions of all these cells that you are going to find in the lymph nodes.